If you have a prostatectomy or prostate surgery coming up, or if you recently had one, it's important to start with focused, gentle exercises early to improve your healing, reduce bladder leakage quicker, and improve your pelvic floor functioning. I'm Dr. Alex Hill. I'm a board-certified physical therapist, and I specialize in pelvic health and oncology. In this video, I'm going to guide you through 3 different exercises that you can start early in your recovery after that prostatectomy to work on your pelvic floor, circulation, and promote healing. Make sure you subscribe to my channel for more videos on pelvic health and cancer survivorship tips and exercises. Before you start any new exercise program, always check with your medical provider first. And especially after surgery, make sure that you move slowly, listen to your body as you're doing these exercises. If anything feels painful or uncomfortable, stop and check in with your healthcare provider. So the first exercise is pretty straightforward. It's a progressive walking program. Walking helps to improve circulation and can help prevent blood clots, as well as help with healing and just getting you back on your feet faster. This can be started even when you do still have the catheter in place, and when you're walking, you want to make sure that you use the leg bag and fasten it comfortably but securely under loose-fitting pants or shorts. You shouldn't feel any excessive pulling or any pain with the catheter while you're walking. With this walking program, you want to start with short, easy, gentle walks around 5 to 10 minutes just around your home a couple times throughout the day. Aim for multiple short walks, again, throughout the day with plenty of rest in between them instead of trying to do one long walk at first. Monitor and track how far you walk and how you feel each time you go, and as you're able to, try to go a little bit farther each time you go out for a walk. As you're walking and afterwards, make sure you listen to your body. If you're tired or sore or you're feeling even more fatigued, back off and rest a little bit more. The next exercise is pelvic floor contractions with your breath. So this exercise should only be started after you've had the catheter removed. With this exercise, you can sit in a comfortable supported chair, or you can lie on your back with your knees bent and your feet flat on the floor. Whether you're sitting down or lying down, you're going to place one hand on your chest and one hand on your abdomen. You're going to breathe deeply in through your nose first, feeling your belly and your chest expand with air. And as you exhale through your mouth for about 5 seconds, you're going to contract your pelvic floor muscles by pulling them inward and upward. So these are your pelvic floor muscles here. They sit at the bottom of your pelvis. And when you do a pelvic floor contraction, it should feel like you are pulling in the penis, you're trying to stop the flow of urine, or that you're trying to stop yourself from passing gas. So again, you're going to have your hands on your chest and your stomach, breathe in. And as you exhale, contract the pelvic floor as you breathe out. Breathe in, let the pelvic floor relax. Breathe out and contract. I'm going to show it with the model. We're going to do a couple more of these. So you're going to breathe in, let everything relax. Breathe out as you contract. Breathe in, let it relax. Breathe out and gently contract. Pull those muscles nice and tight in. Breathe in and relax. Or breathe in through the nose and then breathe out through the mouth as you contract. Breathe in through the nose, feel those muscles relax. And breathe out as you contract and pull those muscles in. As you do these contractions, you should be focused just at the pelvic floor, and you shouldn't be seeing or feeling a lot of activation from your abdominals or your legs or your glutes. So doing this exercise, these pelvic floor contractions with your breath, helps to get more coordination with the pelvic floor and helps you get reconnected to the pelvic floor after the surgery. With this exercise, you can do this in sets of 10. So you're gonna do 10 breaths with a contraction, and you can do this 2 to 4 times per day. But again, you should not have any pain while you do this. So for this last exercise, we're going to use either a pillow that's going to be folded and in between your knees, or you can also use a small soft exercise ball as well. For this exercise, we're going to be doing a adductor or inner thigh squeeze at the pillow. When you do the squeeze though, it shouldn't be very, very hard and a lot of muscle activation. We're just starting to get back into the recovery process after this surgery, and we are coordinating it with our breath, just like we did for the pelvic floor exercises. So once you get yourself set up, either sitting on a chair or lying on the ground with your feet flat, knees bent, place the pillow between your knees or the ball. You're going to breathe in through the nose, breathe out. As you gently squeeze together, you're going to breathe in and relax. Breathe out, squeeze the knees together. Breathe in, relax. Breathe out, squeeze together. So again, this shouldn't be very hard. You shouldn't be feeling your legs shaking, trying to get a really strong contraction. We're just starting to get those muscles activated. These inner thigh muscles also overflow into the pelvic floor muscles and helps with more engagement and strengthening those pelvic floor muscles as well. With this exercise, you can do that breathe in, breathe out with the squeeze for those 5 seconds, and you can repeat that 10 times. And you can do this one just like with the pelvic floor exercises of 2 to 4 times a day as well. Just like with the other exercises with the walking program and with the pelvic floor exercises, you should not have any pain when you do this exercise. So remember, all of these exercises are designed to be gentle and pain-free and progressive, helping you reconnect with your body safely. Once you've mastered these exercises, make sure that you progress your program, especially the pelvic floor program, and check out my video with different types of pelvic floor exercises and movements that will get you drier quicker after that prostatectomy. These are going to include longer endurance contractions, quick contractions, and again, those functional movements to get this healing better and get you feeling better. If you found this video helpful, please like it and subscribe for more pelvic health and cancer survivorship videos, and share this with somebody who needs it.